Welcome to the Nomiki Show. I am Nomiki Konst on day 100 of self-quarantine, 100 days in. When I first arrived at my location of shelter in place, there were barely any cases, and now it is the epicenter, one of the epicenters of COVID. What 100 days. Businesses are opening up around the country. They've prematurely opened up in several states that have red leadership, Republican leadership, and they didn't do it with any, phasing in. So this is the state of our leadership. There's a lack of leadership around the country in responding to COVID. There's a lack of leadership in the Democratic Party in responding quickly enough to the COVID cases because they're too busy balancing their interests and going to committee meetings to decide whether or not, just how hard they want to push back against corporations. This is a crisis that stems from corporate systems. Just today, there was a report by ProPublica that showed that cases where there is privatized medicine, there's an extraordinary spike. Countries where there's privatized medicine, there's an extraordinary spike in cases. And socialized medicine, it has gone drastically down and almost eliminated the cases. So, it's not to say that I remember hearing when Italy had a spike in cases, people said, how does that happen? I mean, they have socialized medicine, but their response, the hospital system's response, you see it in Cuba, you see it in Italy, you see it in France now. They immediately took responsive action to protect its citizens. Now, that doesn't mean that they didn't have the crisis in their country, but they responded to the crisis with the type of action needed. But when you involve business interests, and you couldn't be any more clear than in the red states like Arizona and Texas, the red states to the west of the Mississippi, how they opened up prematurely. And in some cases like Florida or Georgia, their governors were actually, and their families were invested in businesses that were hurting. So when you mix big business with government, whether you're a Republican who decides you're just going to open up the economy and pretend that COVID doesn't exist, and you're ruling by conspiracy theory and not even phasing in with masks, or whether you're a Democrat and you're sitting idle or quiet or taking time to process the CDC's information as they did in New York State and New York City. When you have to sit there and go back to your committee and say, how are we going to balance our business interests with the public health crisis? Then you are part of the problem. There is no in-between. There is no neoliberal answer to this, because all neoliberalism is a more woke version of capitalism. There's extreme, ruthless, callous capitalism that is almost openly racist and sexist and homophobic and colonial. And then there is the sanitized version of capitalism that is just as extreme, just as based in monopolies, just as Wall Street oriented, but creates an illusion of being supportive of the people. And that, as MLK Jr. so finely said, is almost just as dangerous. Just as dangerous. Because that map that ProPublica put up of countries of socialized medicine that have pretty much eliminated the COVID crisis, comparatively to countries like ourselves who have privatized medicine. Privatized hospitals are not just a thing that exists in Republican states. It happens in Democratic states too. It happens in Democratic cities, just as police departments are unregulated in Democratic-led cities. The crisis is neoliberalism. Thank you for watching and listening to the Nomiki Show. Make sure to click like and subscribe on YouTube and share with everybody on social media. And of course, if you're not a patron already, please join us on patreon.com/The Nomiki Show for as low as $5 a month. That money makes a huge difference. We don't have the corporate money coming in. We're not cable news that's raking in the dough from advertisers right now as everybody's sitting at home and watching. It is really you guys who are keeping us together. So please consider being a patron. And for those of you who have already, we are incredibly grateful to you.